Mortlock. She is outside Tygerberg Hospital in the Western Cape, and I should imagine it's not much of a prettier picture there, is it?
Yes, I am at Tygerberg Hospital, and here in the Western Cape we have over 7,000 active COVID-19 cases. As of yesterday, I've just heard from the Western Cape Health Department CRO, Dr. Saadiq Kariem. As of yesterday, we have about 836 hospitalizations as a result of the virus. And according to Dr. Kariem, we are seeing a rising number of infections. But now to find out more about the battle plan by the department, especially in those hotspot areas like Garden Route, we heard last week that they are in the midst of a second wave. Now, what is the department's plan?
Sure. So during the first surge, we obviously had thoroughly prepared and planned our battle plan, as it were. We had decongested our facilities, we had opened additional beds as well in the province, and particularly in the Garden Route, what our battle plan there involves is opening additional wards and decommissioning wards that had happened after the first surge. George Hospital, for example, is our biggest regional referral hospital in the Garden Route area, and in George Hospital we're opening additional beds. We've got additional contract staff that we are going to employ, and we're also going to reopen the testing and the testing unit at the George Hospital.
And speaking of these hospitals, these public health facilities, when last did you visit any of these facilities, not only in the Garden Route but in different parts of the Western Cape? Do you think our public health facilities are equipped to deal with the second wave? What is the state of it?
No, absolutely. The Western Cape is in a very fortunate position in that our hospitals and our primary care facilities are actually very well equipped. During the first surge, we had purchased tens of millions of rands worth of additional equipment. We brought additional beds in. We opened 1,400 intermediate care beds, including the convention centre, our Brackengate facility, as well as a facility in Sonstraal in the rural area. And we are ready to reopen the Brackengate facility again. It's been continuing. We commissioned it, and it's continuing. It's functioning, but we can re-expand that again. So I think in the Western Cape, and including the Garden Route, I think our facilities are well equipped to deal with a possible second surge.
Now that's the facilities. Now we speak about the staff. Over the last week, I've spoken to various health workers in different facilities across the Western Cape. Doctors, nurses, medical officers, they've all told me the same thing. They're feeling overburdened, overworked. We know understaffing is an issue that's been coming on for decades. But how bad of a problem is it in the Western Cape, and what's the cause of it? What's the reason? Is it what we are seeing in other regions where it's the result of not only budget cuts but corruption, maladministration?
Well, again, in the province, we're lucky in the sense that we've had many years of good administration and implementation of a human resource plan. And during COVID, we brought additional staff in. We had a number of volunteers, people who just volunteered their time to work in our public facilities. We had private GPs that were able to come and help us in our hospitals. So yes, I think the staff are obviously overworked. I think one of the big concerns as we move forward into the festive season is in actual fact that given the violence, the expected violence and trauma that normally increases this time of the year, particularly given that alcohol is more freely available, we are obviously concerned that that's going to place an additional burden on our staff whilst they're having to treat our COVID caseload as well. And we also have additional support programs in place for our staff who are feeling a bit overburdened and fatigued. We had, after the first surge, encouraged some of our staff, those who could, to take leave so that they can actually refresh themselves and reinvigorate themselves. But even I was told to take some leave so that I could reinvigorate myself. So we have a battle plan for our human resources, but obviously having said that, our concern remains the festive season and the increase in trauma and caseload that will place an additional burden on our already hard-working staff.
Thank you very much for that. That was Dr. Saadiq Kariem, the Western Cape Health Department COO.
All right, Monique, thank you very much for that. Let's leave it there. We're looking at the state of our public hospitals in South Africa, and I'm sorry to wrap it up by saying it's a pretty sorry state. Monique, Aviwe, Dessen and Mankopa.